Welcome back to another video. Today we're gonna discuss about some important topics. First are the drugs which we need to give in pulmonary edema. The mnemonic is LMNOP, Lasix, morphine, nitrates, oxygen, and you should change the position in upright versus flat. Functions of the kidney. The mnemonic for this is a wet bed. A for acid-base balance, W for water removal, E for erythropoiesis, T for toxin removals, B for blood pressure control, E for electrolyte balance, and D vitamin D. The next is the difference between alkalosis and acidosis. Rome is the mnemonic. Respiratory means opposite. In respiratory alkalosis, pH would be high and carbon dioxide would be low. In respiratory acidosis, pH would be low and carbon dioxide would be high. On the other hand, metabolic means equal. In metabolic alkalosis, pH would be high and bicarb would be also high. In metabolic acidosis, pH would be low and bicarbonate would also be low. Stages of labor and delivery. First stage is when there's onset of labor to full dilation. In second stage, cervical dilation to birth, and the third stage is when there's birth to placenta delivery. On the fourth stage, placenta delivery to patient stability. These are some therapeutic drug levels. Digoxin is 0.5 to 2 mg per ml. Lithium is 0.8 to 1.5 MEq per liter. Daruntin 10 to 20 mcg per deciliter. Thiophalline 10 to 20 mcg per deciliter. These are some normal hematology values. RBCs 4.5 to 5 million, WBCs 5,000 to 10,000, platelets 200,000 to 400,000, HGB is 12 to 16 grams in women and 14 to 18 grams in men. Next is the antibiotics that are contraindicated in pregnancy. The mnemonic is MCAT. This is a medical entrance exam in Pakistan, so you can remember by that name. M for metronidazole, C for chloramphenicol, A for aminoglycosides, and T for tetracycline. Easy way to remember Addison's and Cushing's is Addison's disease need to add more hormone. Cushing syndrome have extra cushion of hormones. Pink and frothy sputum is distinctive for two things: congestive heart failure and pulmonary edema. Now comes the difference between ICP, intracranial pressure, and shock. These are opposites. In intracranial pressure, there is increased BP, decreased pulse, decreased respiratory rate. On the other hand, in shock, there is decreased BP, increased pulse, and increased respiratory rate. In this slide, we're gonna learn about the effects of anticholinergic drugs. There would be dry mouth, which means they can't spit. There would be urinary retention. This means they can't pee. They would be constipated. This means they can't poop. And there would be blurred vision, which means they can't see. Do you know what is the most common transfusion reaction? Yes, you're right. It's febrile non-hemolytic reaction. What is the treatment for ventricular tachycardia? The treatment for ventricular tachycardia is, the mnemonic is LAMB, which you eat daily. L for lidocaine, A for amiodarone, M for magnesium, and B for beta blocker. What is PUN? PUN is waste product, that is the end result of protein metabolism. What is dopamine? Dopamine is sympathomimetic drug which treats cardiogenic shock, and the function is that it improves myocardial contractility and blood flow through vital organs by increasing perfusion pressure. In anticoagulant drugs, you have to monitor prothrombin time for heparin, where normal level is which is between 1.5 to 2 times the control, and no specific bleeding time should be monitored for enoxaparin. Monitor platelet count, bleedings, and silent symptoms of infection. What is mororeflex? Mororeflex is when startled by a loud noise, the baby would flex his or her legs, and arms and hands would be extended. In tonsillitis, which type of diet you should consume? You should have only clear liquid. In cystic fibrosis, your diet should be of high calorie and high sodium. In Cushing disease, your diet should contain high potassium and low sodium. In hypothyroidism, you should take low sodium, low cholesterol, and low saturated fat diet. When you have acne, go for low fat diet. For diverticulosis, diet should contain high residue with no seeds. In pancreatitis, one should consume low fat diet. Which are the pituitary hormones? For that, there is a mnemonic which is called flag top. F for follicle stimulating hormone, L for luteinizing hormone, A for adrenocorticotropin hormone, G for growth hormone, T for thyroid stimulating hormone, O for oxytocin, and P for prolactin. Treatment for asthma comprises of adrenergics, steroids, thiophanine, hydration, mask for oxygen at 24%, and antibiotics. In cretinism, you should have diet with high protein and high calcium.